Good morning, everybody. I'm Krista Barbie with Partners. I want to welcome everybody to this month, November's Community Cafe. Trying to give everybody just another minute to sign in and get in, and then we'll get started. Okay. This morning, we're going to talk about tailored care management and also Medicaid expansion. And so I'm going to go ahead and introduce our first speaker, and that is Tammy Guess with Partners.
Good morning, everyone. I'm Tammy Guess, and I am the supervisor for the, we have a foster care team. We actually have two foster care teams here within Partners, and we work specifically with members that are in foster care with one of our 14 counties. So I'm one of the supervisors of that team. So I'm here today to talk about TCM and specifically about the care management functions and how we work with our members. Okay, can everybody see my screen?
No.
No. No? Okay. Hold on, I think I hit the wrong button. Maybe. How about now? Perfect. So historically, the LMEs and MCOs have dealt with just members who have mental health, substance abuse, and IDD issues. That's all changing now because MCOs are now going to roll over and start doing tailored care management. And you may hear me refer to tailored care management as TCM moving forward. So before I start talking about TCM, I'm not sure what all y'all know in regards to standard plan versus tailored plans. I just wanted to give you a little bit of information. Standard plan rolled out last year. And basically what that is, that's in regards to members who are receiving out basic services. Okay, so basic outpatient services or med management. All those members rolled over to the standard plan. Tailored plan, however, is a little bit more comprehensive, and we're looking at members that require more intensive or enhanced services. So these are members who receive services like intensive in-home, out-of-home placements in regards to children, people who are receiving CTS services for adults. So when we're talking about tailored plan, we're talking about enhanced services, and we're looking at the whole person. So I think just the other thing that I wanted to mention in regards to this slide is integrated care is the whole person care model. Okay, so we're looking at the person in its entirety. That's new for the MCOs. Like I mentioned, historically, we just dealt with the mental health and substance abuse and the IDD spectrum. Now we are looking at the physical health. We're looking at the pharmacy needs of our members. We're looking at transportation. We're looking at the member in its entirety. And if you would, I would like to save our questions toward the end. That way we can answer them. And I have presented this this presentation along with a copy of all the TCM providers for your access and for your review. Okay. So when we look at tailored plan populations, the members that we're going to be serving, these are members who have Medicaid and who had previously had health choice. All those members have already been rolled over to us, and they're now being monitored and served by the MCOs. People who have an IDD diagnosis and people who are on the innovations waiver or who've had a TBI, traumatic brain injury. So that's what we're looking at in the populations that we're serving. Also, I put on here the non-Medicaid behavioral health, developmental disabilities, and TBI for uninsured and the underinsured population. On this slide, what I would like to point out, actually several of them. Members will have the ability to choose what program they want to go to. Right now under TCM, there's 3 programs that are available. You can stay with your LME, MCO. In this case, it would be partners. So that's one option to receive TCM. You can also receive TCM services through a CMCA, which is the Care Management Agency, or the AMH Plus, which is Advanced Medical Health Plus. So all 3 of those entities can provide TCM to our members. One other thing that I wanted to mention in the second point is that members can change their care management provider twice a year without call and at any time with calls. The whole thing about TCM is that it's going to be member or family or legal guardian choice. So you have the choice to decide which agency you want to provide the TCM service. Also, the last point that I mentioned here is you can opt out. If a member does not want TCM services, then you can opt out at any time without any kind of penalty or without any kind of rebuff. You can also opt back in if you later decide that you need a more enhanced services and more comprehensive care. And I think I hit all my bullets that were on here. Here I've talked about member eligibility. The first members that we received that were eligible for TCM came from the state. So the HHS composed the list. They sent it out to the LMEs and MCOs across the state. And that's how we got our first bundle of members that were eligible for TCM. But that's not to say that we can't receive referrals at any time. As you can see here, partners will enroll Medicaid beneficiaries with serious mental illness, emotional disturbance, severe substance use disorders, an IDD, or TBI. So we accept referrals from family members. We accept referrals from physicians, from therapists, from DSS, DJJ. Pretty much any member. And on the back page is, as I took the contact information on how you can make that referral and get connected to a care manager. One thing that I did want to point out, and I think that's on the later slide, is not everyone will be eligible. As I mentioned, the criteria earlier, you have to be eligible for an enhanced service. There are a few exceptions to TCM, and this is when a member is receiving a duplicative service. A duplicative service is a service that contains care management from another service. And the services that the state has identified here as being members who are receiving ACT, members who are in an ICS, children who are at risk, so CMARC members who are receiving high fidelity, members who are CAPC, and programs of the all-inclusive elderly, so PACE members, and then the tribal option. So these are all members who are excluded from receiving TCM. And the reason for that is, again, because they consider that a duplicative service because they're getting some of the same care management functions in those services already. And I know I'm hurrying through here because I know we're time limited and I've got several slides to go over. But again, if you would just save your questions toward the end, and I will do my due diligence to try to answer those. Oh no, on this page, I just wanted to point out how Partners is assigning our members, not necessarily to ourselves, but also to the AMH pluses and to the CMCAs. They're looking at provider relationships. So if a member has a relationship with their provider, then and they want to receive the TCM service from them, then we're assigning to the provider, or the provider's assigning themselves. We're looking at member preference. Again, members can choose what TCM program they want to go to. If the member requires a specialty, and again, they have a choice to choose which TCM program they are going to. We're looking at location where the member is currently housed, and to see what TCM provider is close by. And we're also looking at capacity. You know, sometimes, not now because we're just starting and with enrollment, but not everybody is at capacity. But hopefully in the foreseeable future, everybody will have full caseloads. So we'll be able to serve our members, but we're also looking at capacity, who can serve these members. I won't read all of this to you, but when a person is receiving care management services, the care manager is responsible for completing a comprehensive assessment. These comprehensive assessments are whole person. We are looking at the physical health, the behavioral health. We're looking at substance use. We're looking at work history. We're looking at education. Every component that goes into the person we're looking at. These assessments are conducted at least yearly, and they will be updated as any changes come into place. Say a member transitions to out-of-home placement, or the member requires a hospital admission, then we will update the assessment to reflect all the changes or the transitions that occur. And again, you can see from this checklist, I included everything, you know, after a significant change in health or functional status. So if a person deteriorates, then we may want to include that in the assessment to reflect the change. So I've outlined all of the criteria as to when the assessment would be completed. Formation in multidisciplinary care teams. So here we're looking at each member will have a multidisciplinary team. Okay, that team will consist of the care manager, the provider, the physician. Of course, if there is a family member or a legal guardian, if the member is a child, then they will also be active on this multidisciplinary team. The teams will meet at least monthly. We will review the progress of the child or the member. I can't say child. I primarily work with children now. So if I say child, I mean I mean member too, because it encompasses them as well. But any change again that comes up with the member, it will be reviewed in one of our team meetings. Along with the assessments that the care manager will complete, we will also complete a care plan or an IST development if the member is IDD. And here we're looking at input from the team, from the member. We're looking at the assessments. We are looking at the locus or CalLocus scores, the ASAM if substance abuse is an issue. We're also looking at the CIS or innovation members. And that's how we're developing these plans. This slide talks about the frequency of when the plan is to be completed. It also talks about when changes are needed. Again, these plans are good for a year for us. I know with PCPs, it kind of follows the same plan. Care plans are very similar. We're also documenting when change occurs, if there's a transition, if in the member status and they transition to an inpatient facility, or there's a decline in their symptoms, and that will be documented on the assessment as well as on the care plan. Again, this just continues to talk about care plans, who will be involved. It talks about the care plans, participants, legal guardians, the caregiver, DSS, if they're involved, and of course the member being involved in their own plan as well. And hopefully identifying some goals that they too want to work on. The next couple slides talk about specifically care management intervention and what the care manager will do to assist the client. So here, we're looking at coordinating and making referrals to services, trying to get our members linked to the appropriate provider, making sure that there is a assessment completed on the member, making sure that the member has a physical health assessment as well, making sure that everything is documented in our system so that we're looking at whole person, making pharmacy referrals, checking their medications to make sure that they're taking the correct medication. Sometimes our members will be taking medications that are either outdated or that have been discontinued. So reviewing their med list with them frequently to make sure that they're getting, all their needs met and they're following their plan accordingly. Again, here is some other interventions. I think I made 2 or 3 pages. I included everything because I wanted to be as comprehensive as possible. Again, this talks about following up on referrals for us, and specifically with the child team. We're constantly looking for placement for our members. They often disrupt their placement, so having to find a new home, maybe a higher level of care. It could even be a transition to the same level of care. That is something that we frequently do, even if it's a member who does not meet the criteria for TCM and they are a Medicaid direct recipient. We have a team that will work with them short term to make sure that their needs are met. If placement is an issue, if it's getting their medication, getting them linked to the proper provider, or not just providers, I should say, because moving forward, we're not just looking at the physical health or mental health, we're looking at the physical as well. So getting them linked. So we're looking at people who to uninsured as well. And I can't even speak today, facilitating them. Again, here is a third page on our interventions. I won't bore you by going over each bullet, but hopefully you'll have access to that and can read through that. We want to utilize a comprehensive approach where we are working, in tandem with one another. Going back to the care plans, all involved parties with that member will receive a copy of that care plan for the member's file. So if it's the physician, for instance, their office will receive a copy of our care plan. The idea behind this is that we are collaborating and talking with one another to ensure that our members' needs are being met. Another page of interventions. One thing that kind of caught my attention is if a child is struggling in school. We've often gone to the schools and participated in 504 or IEP meetings, and we are, trying to advocate for our members, making sure that all of their needs are being met. This is a slide in regards to women, a certain population that we're dealing with. Pregnant women are be at high risk, so we're targeting them. We're following them up to 6 months after the birth of their children, and so making sure that these women that are at high risk get the needs that they need and get the services. So here is a slide in regards to our contacts. Our members each have an acuity ranging from low, medium to high. Our low members have a contact of 1 time per month, and then a face-to-face visit with these members twice a year, so once every 6 months. And then medium, it goes up a little bit more, where we're having contact or face-to-face contact with them. We're going to do 3 or 1 per quarter, which would be 4. And then for high acuity members, we're having a face-to-face contact with them on a monthly basis. More frequent contact. So here's a list of what that looks like and how that reflects our documentation as well. And then this last slide is some contact information for our members and their families, and how they can get enrolled, or how they can even opt out of services as well. And I've put our access number on there as well. And you can use the access number to either get enrolled or to opt out of services. Okay, so that concludes my presentation. I know I kind of hurried through that, but I wasn't really sure how much time to spend, and then how much time we would have for questions. So does anyone have any questions?
Tammy, so it's all right for us to share the PowerPoint with everybody who's attending? Is that correct?
And you can send the list, the other list as well. The other list was the list of TCM providers.
Okay, great.
And if I need to get you a list of the AMH Plus providers, I can do that as well.
That would be great if you can have access to that.
I can do
We
that.
Send that to everyone. Great,
Sure.
Thank you so much, Tammy.
You're welcome.
Any questions
Anyone have-
for Tammy? Okay, we're going to move along, and Jeannie Patterson is going to give us some information on Medicaid expansion.
So thank you very much. This won't take very long because there isn't a whole lot to say about Medicaid expansion, but I wanted to give you some information and some ideas of where to get more information if you would like, more. just about everything that I'm going to show you today comes straight from the North Carolina Department of Health and Human Services website. So you can all access that. And Amani is going to put some of the links to some of the documents in the chat for you if you would like to download these. So this is a copy of a PowerPoint that was put together by the state. And you'll notice that it was done several months ago. So some of the dates it refers to has already taken place. But basically, starting December 1st, more people will be eligible for Medicaid because what's happened is that they've increased the raised the income and also some of the things about the ages as well. So this will of course start December 1st. And it's estimated that about 600,000 people who live in North Carolina will now be eligible for Medicaid who were not eligible before. You will see here, let's see, just of course, I think most of us know this, but this is the kind of services this type of services that people who are receiving Medicaid can get. So of course, primary care, as well as hospital services, definitely maternity and postpartum, prescription drugs, behavioral health, of course, and preventive wellness services, dental services, and services regarding devices or other kinds of therapies folks might need. So this shows you who is eligible. So the column on the right are people who have been eligible for Medicaid, and the column on the left now is the new eligibility. So you see there gives the income range for people all the way up to families of 6. And this is, for the most part, these are people who are lower wage earners. So people who have been working and perhaps could not have afforded health insurance in the past will now be eligible, of course, for Medicaid. There are some immigrants are eligible. I'm not going to go through a lot of the criteria, but it involves the length of time you've been in the United States. I think there's a 5-year period that if you've been here and you have documentation, you've been here for 5 years, you then can become eligible. There are some exceptions for people who are refugees or who have come here seeking asylum who may be eligible sooner than that. But again, this is the kind of question that if you can apply and find out from DSS whether or not you're eligible for Medicaid for that. Of course, Medicaid has no cost to the individual. There may be a copay for some services. I think I probably shouldn't really say, but I think it's mainly for people often for the prescriptions. There may be a copay as high as $4 for that. So if someone wants to apply for Medicaid, here is the information that you'll need to have ready. Of course, you'll need to have this basic information: name, date of birth, social security number, or documents regarding immigration, proof that you're a resident of North Carolina, and then income information to document what your income is. Of course, you see here the website where you can apply for that. And then if they want more information, this is what they'll typically be asking for. Again, there's just some ideas about how to prove that you're a North Carolina resident, what kinds of things will document your income. Of course, you have to document your date of birth, and of course, your social security, again, the citizenship status or your immigration status. So if some people, I mentioned 600,000 people who would be eligible, who on December 1st will be eligible for Medicaid, who were not previously. Approximately 300,000 of them are receiving limited benefits through family planning benefits. They have already received letters and information about the fact that they are going to be moved from this limited family planning benefit to full Medicaid. And I'll talk briefly about that in just a moment. But again, they should have already gotten the letter from their Department of Social Services telling them that they're automatically being moved. They have been assigned a health plan, and they have 90 days to choose a new one if there's one that they think they would prefer. They will then be getting their packets. I'm not sure what the status is on getting their packets with their new Medicaid card on that. People who are receiving services from healthcare, healthcare.gov will need to cancel that because they don't need to pay for that because they will be getting full healthcare through Medicaid. So here's some ways that people can apply if they think they might be eligible, and particularly if they're not in that category of receiving family planning benefits. So of course you can go to ePass, as well as filling out a paper application, going to social services, or calling your Department of Social Services. I have spent a little time just looking around on the ePass site, and it seems to me that it's pretty intuitive. It looked like it wasn't too difficult to work with, and that is the fastest way to apply, and to get everything in, and then to get your paperwork to find out the truth whether or not you've been approved. So, but these are the choices that everyone has to do that. So just be aware that it can take up to 45 days to get a decision. Could take longer if all the information is not there. Again, as they say, applying on ePass is the fastest way. And then you'll see too what it can let you know if you don't have all the documentation that you're going to need. So of course, it's always make sure your information on ePass is up to date, so you'll get the letters and things that coming to you. And you have the option to sign up for an enhanced ePass account, again, so you can get more direct information from social services. And then once you're approved, you will begin, most people will be part of North Carolina Medicaid managed care. I'm not going to go into a lot of detail about that because that hasn't changed. We talked about, Tammy's already talked about standard plan some, as well as the tailored care management, and then the other services right now, the Medicaid Direct for some people, as well as the young people in foster care right now, and also the tribal option. All of that stays the same. So this will be, so this is for, again, it will be the same options that you've had previously, but you'll just be getting Medicaid if you qualify for that. You do have the option to change your plan, as we said, also change your primary care physician. And as we said, people will receive their ID cards in the mail, and it should have the name of the primary care physician. And of course, if it doesn't, then you would want to contact social services to see about getting that changed. Then, this is important because this is very timely right now. If someone applies and say they apply, they start the application on December 1st and find out that they're not eligible, they still may qualify for lower cost health insurance through the Affordable Care Act Marketplace, healthcare.gov. That is open until January 15th. Open enrollment is open from now. It's already started until January 15th. And if something happens, for example, if someone were to lose their Medicaid or have some other kind of life event, they can apply other times of the year. But the open enrollment is going on right now through January 15th. So you just apply for that and see whether you qualify for that. And again, there's a link there for more information on that. And that brings me to the end of the PowerPoint from the state. I just want to briefly mention some of the other things. If you go to the DHHS website, there's a Q&A section that you see here that has a lot of questions and links to more information. There are a couple of flyers that are really good. This is a flyer that's available if you wanted to pass this on to other people. Says a lot of what I've said in a more concise manner. So that's available in English and in Spanish. And there's another one that is called What Happens on Day One. So again, more concise information. So those are available to you. And I believe Amani's going to be putting things in the chat. There's also, this is the homepage again for the Department of Health and Human Services website, and the links here to all the information on Medicaid expansion. And there's another, I think you take it down. I took it down. There's also, Amani's going to send you put some links. There's also a document where you can go and look at a comparison of the different value added benefits that the individual plans offer. So you can see, for example, with some, there might be some that have a lot of things that are focused on families with very young children and maternity kinds of benefits, added benefits, rather some that may have something that's maybe better for someone, a family that doesn't have, whose children are not younger, that might be after school programs and things like that. But if you look at that comparison chart, you can find out, you can find some of those things. You can also access that, a comprehensive one through the website that's available, and that's Amani has already put in the chat. I just finally saw the chat. And that brings me to the end of this presentation. We are getting done early, but we are still available for questions and answers if anybody has anything they would like to know. Anybody have any questions for Tammy or for me? Just let you know also, Amani's also put in the chat links to YouTube to see this presentation once it's been posted. It's been the recording once it's been posted on YouTube, but also you can go back and look at previous community cafes that see what's taking place in other months if you weren't able to be with us.
Thank you, Jeannie, for giving us that information. If there's not any questions, I'm going to give another 30 seconds for any questions, anyone? Okay. Well, thank you guys, everyone, for coming, and I'm going to turn this over to Paul Holden to give us a closing.
All right. Well, thank you very much for everybody participating today. And so we want to thank Tammy Guess of Partners. She gave you a lot of comprehensive information. Hopefully you'll be able to pull that off the chat and look at that over time. If you have any questions about it, the contact information is there for you to contact her or anyone in Partners who can kind of talk to you a little bit about tailored care management. We want to thank Jeannie Patterson for giving us that information about Medicaid expansion. And you can see all the various levels of information that the Department of Health and Human Services has put out. So take a good close look at that, and you can pull flyers from that, and you can help some of your members as we go forward. In terms of the community, so anyway, thank you very much. That's a lot of information today, so probably take some time to digest that a little bit. December, the community cafe will not happen. We realize it's a busy time for everybody, and so we are going to cancel December. We will hold community cafe again in January, and that will be based on the specialty courts that have cropped up and been created and how they affect the community and the work that you do. So we would love to see everybody again in January. I guess in the meantime, if there's anything else from anyone, I would want to say, please have a safe and healthy holiday season. And we appreciate the work that all of you do. You know, we're in it for the folks that we work with. And so we appreciate it. And you should enjoy a little rest time here over the holiday season. Thank you very much for joining us. And if there's nothing else, I think we're done.